So welcome to the second part of today's lecture. This time we're going to talk about aviation and space physiology, the different effects of acceleratory forces on the body. So let's review a little bit of physics for today's lecture. So there are two kinds of acceleratory forces on the body. You have your linear acceleration, or when you speed up, and linear deceleration when you're slowing down. But there's also a third kind of acceleratory forces, a centrifugal acceleration and when you turn. So for example, when you're in a rocket ship and it suddenly turns, it has corresponding acceleratory force on your body. And the degree or the rate of the force is directly proportional to the mass of the object, if it's a person, your weight, and then the velocity of the travel, how fast you're going, and the acceleratory force is indirectionally proportional to the radius of the curvature of the turn. So if the turn is not so sharp, then the force is not so weak. If the turn is sharp, no, it's small, the radius is small, the force is greater, no? And conversely, no, the force of acceleration is directly proportional to the sharpness of the turn and less radius. So I hope you got that. So in this formula, it's indirectly proportional to the radius. So the less the radius, the greater the force, because the less the radius, the more sharp the turn is. Okay? So let's say you're riding a plane and your weight is labeled as 1G. No? So if the plane suddenly goes on a loop-the-loop, no, your body experiences positive 5G acceleratory force, no? Because of the acceleration, no? As well as the linear acceleration and the centrifugal acceleration. If the plane is pulled out from a dive, no? Let's say the plane goes down and then suddenly pulled out from a dive, that's negative 1G. No? Okay. The centrifugal acceleration effects. So if your body experiences positive 5G, what are the effects on the circulatory system? So just imagine, let's say you have, let's say this one. You see this one? This is a bottle with water. Remember, if you put it like that, the water will go up. Or if you pull a glass of a pail of water and then you throw it like that, no? A pail with water, the water will not drop on you. No, this is because of the centrifugal force, no, or the centrifugal acceleratory forces. And similarly, this positive 5G acceleratory force has that similar effect on your circulatory system. This is because this positive 5G is important because it has impact on the blood, because the blood is mobile and can be translocated by your centrifugal force. So for example, if the water is blood, no, if you pull it like that, no, it has an impact on where your blood goes. No? So for example, if it's positive G, you move up this one. No? The blood moves toward the lowest portion of the body. Okay? Can you imagine that? No? If you're immobilized in a standing position, there will be increased pressure in the veins of the feet. and blood pools to the lower part of the body. And because of the pooling of blood in your legs, there is less blood for cardiac output. And recovery is caused mainly by activation of the baroreceptor reflexes. So the baroreceptor reflexes will cause corresponding vasoconstriction in order to try to improve your cardiac output. No? So acceleration greater than 4 to 6 G can cause a blackout and unconsciousness. And if not corrected, no, this can lead to death because of the low cardiac output, because of the pooling of blood in the lower part of the body, because of the centrifugal force. So other effects, no, because of that great impact of the force, it can cause fracture to the vertebrae, especially if it's more than 20 G. It can cause compression fractures in your vertebrae, and this can cause paralysis. In negative G, remember when you're dive and you're suddenly pulled out from the dive, the effects are less dramatic acutely, but more damaging permanently. At negative 4 to negative 5 G, there is intense momentary hyperemia of the brain. So in positive 5 G, the blood pools to the lower extremities. In negative G, the blood can pull to the upper part of the body, particularly your head. No? And because of the intense momentary hyperemia or sudden blood flow, sudden increase in blood flow to the brain, this can cause brain edema, which can later cause psychotic disturbances. In higher negative acceleratory or centrifugal forces, the small vessels on the surface of the head in the brain can rupture because of the great pressure. And the CSF, or your cerebrospinal fluid, is also centrifuged towards the head at the same time that blood is centrifuged towards the cranial vessel. And because the vessels inside the cranium show less tendency for rupture because of the cushioning by the CSF. So if you don't have any more CSF, or the CSF is centrifuged, the vessels will have less cushion because of less cushioning by the CSF. The eyes can also experience intense hyperemia that occurs in strong negative G and can cause temporary blinding with the red out. Okay. So how do you protect yourself against centrifugal acceleratory forces? So in the military, the one that uses those airplanes, they've been trained on how to protect themselves from the centrifugal acceleratory forces. And you can do this by tightening of the abdominal muscles to an extreme degree and leaning forward to compress the abdomen. So when you compress the abdomen, you prevent the blood from going down or going up, from the center of your body. Okay. Anti-G suits applies positive pressure to the legs and abdomen by inflating compression bags as the G increases. So if you squeeze this out, with compression bags, it prevents pooling of blood in the lower abdomen and legs and maintains cardiac output. Okay. What are the effects of linear acceleratory forces on the body? So acceleratory forces is most prominent in space travel. So because a spacecraft cannot make rapid turns, so there's not much impact of centrifugal forces. And because of this, they actually have tremendous linear acceleration, especially during blast off. So during blast off acceleration, there's positive linear acceleration. And in landing deceleration, you have negative acceleratory force. So during during takeoff, there are acceleratory forces during takeoff of a spacecraft. So at the first booster, the G can go as high as 9G. And then on the second booster, as high as 8G. And when you're already in the spaceship, no, the acceleration would be at about 3g. So during blast of acceleration, we mentioned early, as much as 9g, the human body cannot withstand this in standing position because all of the blood will be pulled down to your legs and you will no longer have any cardiac output or any circulation into your brain. So what the astronauts do is place themselves in a semi-reclining position, which allows the body to withstand this with ease, no? That's why the seats of astronauts are in a reclining position. Deceleratory forces can be illustrated if, on the other hand, with a parachute jump, no? With the use of a parachute, it slows your fall to 1/9 of the terminal velocity. If, let's say, your terminal velocity without the parachute is, let's say, 100 meters per second, no? If the parachute will slow it down. The force of impact can still cause damage, but it will lessen, no? It will lessen the force, no? But but there's still a force of impact. So it's important that you should strike the earth with knees bent but muscles taut to cushion the shock of landing. So if you fall on extended legs, no? Let's say this is your knee and this is your leg. If you fall on extended legs like that, it will cause extreme, tremendous deceleratory forces resulting in fracture of your pelvis, vertebrae, or your leg. So make sure your knees are bent to lessen the shock of the landing. So in space, they created an artificial climbing, okay? There's no atmosphere in outer space. So when you don't have a space suit, no, there's no air, you will die almost instantly. So inside the spacecraft, they created an artificial atmosphere. So the oxygen must remain high enough and the carbon dioxide low enough to prevent suffocation. So it's just like mimicking the atmosphere on Earth. Okay, so the gases in a modern space shuttle, the gases about equal to normal air are used with 4 times as much N as oxygen to decrease the chance of fire or explosion and a total pressure of 760 millimeter mercury. Remember, we discussed earlier about the barometric pressure at sea level, so that's 760 millimeter mercury. So inside the modern space shuttle, they recycle the oxygen so that there's a constant supply of oxygen for the astronauts. And this is done by electrolysis of water to release oxygen. No? They use algae, no, with chlorophyll. Okay, so remember this is Stephen Hawking when they tried to make him experience weightlessness in space. So in space, there's near zero gravity, near zero G force. No, it's not positive G or negative G, but near zero. And this is called microgravity. So this happens because gravity acts on both the spacecraft and the person at the same time. So they cancel out one another. So positive G plus negative G equals near zero G force. No? What are the physiological challenges of weightlessness? Astronauts can experience motion sickness during the first few days of travel. There could be translocation of fluids within the body because of failure of gravity to cause normal hydrostatic pressure. So there's still acceleratory forces affecting your body fluids. And there's also diminished physical activity because no strength of muscle contraction is required to oppose the force of gravity. That's why astronauts are required to do exercises inside in space, no, in order to prevent their muscles from undergoing atrophy. If you stay long enough in space, no, these are the effects. So these are, I forgot the name of these two astronauts. These are twin astronauts, and they did an experiment on the effects of prolonged stay in space. One of the twin astronauts, I forgot their name, sorry. One of the astronauts, one of the twins went into space, and one of the twins stayed on Earth. And they looked at the changes after one of the twins returned from space, no? Because they're twins, they're genetically identical, okay? So they found that in prolonged stay in space, there will be a decrease in blood volume, decrease in red blood cell mass, decrease in muscle strength and work capacity, decrease in maximum cardiac output. There's also loss of calcium and phosphate from the bones, as well as loss of bone mass. So they're also very prone to osteoporosis. Okay? During very long space flights and prolonged exposure to microgravity, there is deconditioning of the cardiovascular system, the muscle, and the bones. And this occurs even despite rigorous exercise. So what more if they don't exercise in space? No? So this results in loss of bone mass or osteopenia or osteoporosis, atrophy of cardiac and skeletal muscles. And this cardiovascular deconditioning results in decreased work capacity, reduced blood volume. They may be unable to stand upright upon return, and there's also an increased fracture risk, no, despite having rigorous exercise, no. And the countermeasure is application of intermittent artificial gravity while in space, and this is about 1 hour each day of centrifugal acceleration. Okay. Next, we go to the last part of the lecture. So earlier we discussed events in high altitude, ranging from mountain climbing to aviation to even outer space. But this time we're going down, deep down below sea level, and talk about physiology of deep sea diving and other hyperbaric conditions. So this is just quick. So what are the effects of sea depth on pressure and on gas volume? So normally, to keep the lungs from falling, air must be supplied at very high pressure to keep them inflated. So if the pressure drops, no, your lungs can collapse. Hyperbarism happens if the exposure, the blood in the lungs is exposed to very high alveolar gas pressure, which happens in the depths, in very low depths in the ocean or in the sea, no, at very low sea level, below sea level. So what happens as you go down the sea? So at sea level, there's at 1 liter of air is equivalent to 1 atmosphere. So at 33 feet, when you, let's say you have a container with air inside and you put it in water, that's 1 atmosphere. If you press down and air is still inside, air inside, no, is compressed, no, to about a volume of 1/2 liter. And because of that compression, no, there's smaller volume, there's greater pressure inside. And as you go down, no, under the sea, the volume of the air is compressed further and reduced further to smaller volumes. And the smaller the volume is, the greater is the pressure. The greater is the pressure of the gas inside. No? So it's the opposite. At higher altitude, there's lower pressure, there's lower partial pressure, in deep sea, there's higher partial pressure. So remember Boyle's law, the volume to which gas is compressed is inversely proportional to the pressure. So let's see here, the pressure here is 1 atmosphere at 1 liter of volume. Here at 100 feet, the volume is only at 1/4 liter, but the pressure is greater, no, at 100 feet, and so on and so forth. No? So that's why as a diver, no, if you go as you go down, no, the sea, the increased pressure at the sea, lower parts of the sea, can collapse your air chambers, no, and can sometimes cause serious damage because of the immense pressure at the ocean floor. What are the effects of high partial pressure on individual gases? So normally air is composed of nitrogen, oxygen, and carbon dioxide. At high pressures, no, at high pressure meaning at lower sea depths, no, nitrogen narcosis can occur at high pressure. At 120 feet, as you go down the sea, you can have joviality and you can lose many of your cares, no. At 150 to 200 feet, no, you can become drowsy. If you go down lower, especially if the descent is very fast, no, you can have clumsiness, loss of strength. This is because of nitrogen narcosis. And beyond 250 feet, you can become useless, raptures of the depths, and there's reduced neuronal excitability, and this is similar to alcohol intoxication. So this is your nitrogen narcosis. It's you're like on narcotics, no? That's why it's called nitrogen narcosis. How about oxygen, no? As opposed to high altitude, when you go down to lower sea depths, the amount of oxygen dissolved in the blood increases with high pressure. So as the oxygen pressure rises above 100 millimeter mercury, a large portion of the total oxygen is dissolved in the blood, in addition to that bound to hemoglobin. When you go down to sea level, oxygen is not much of a problem. The problem really is the nitrogen narcosis. So these graphs illustrate the changes in the oxygen in the blood, no? So this is the total oxygen in the blood, no? This graph over here on top. And this is the graph of the amount of oxygen dissolved in water in the blood. So at about So at point A, the oxygen in the blood would be about 29 volumes percent, and the amount of dissolved oxygen in the water is about 9%. No? As you go down to sea level, no, the volumes percent of the oxygen in the blood is reduced, no? But the oxygen also is reduced, but this is delivered to the tissues at extremely high pressure, no? 1,560 to 3,040. The normal value is only 40 millimeter mercury. So you can just imagine the tremendous amount of pressure in the lungs at low levels. You know? So what happens? You will have acute oxygen poisoning because of the tremendous amount of oxygen that is delivered into the tissue. So you can also get poisoned by oxygen. No? That's why in the ICU, we also regulate the O2 that we give to our patient because it also has an effect. You just can't give a random number at the amount of oxygen. So with acute oxygen poisoning, you can have brain seizures followed by coma and death. Other symptoms would include nausea, muscle twitching, dizziness, disturbances of vision, irritability, and disorientation. So these are the symptoms of oxygen toxicity. With chronic oxygen poisoning, you can have pulmonary disability. And this is even at 1 atmosphere oxygen exposure for only about 12 hours. No? And this can cause these problems. And this is due to the direct exposure to high oxygen. How about with carbon dioxide? So the depth does not increase the rate of CO2 production in the body. In certain types of diving gear, no, especially those that are old models, no, the CO2 can build up in the dead space air and can be rebreathed. And this can cause CO2 accumulation in the body. So if there's the CO2 normally would be between 35 to 45 millimeters mercury. But if it goes beyond 80 millimeter mercury, you will have CO2 accumulation, you will have respiratory acidosis. And with respiratory acidosis, this causes respiratory center depression and severe acidosis, lethargy, narcosis, and finally even anesthesia, can't feel anything. So what to do? So we do decompression of the diver from excess exposure to high pressure. When a person breathes air under high pressure for a long time, the amount of nitrogen dissolved in the body fluid increases. So what do they do? So remember, it's not just oxygen that you get poisoned with, but also the amount of dissolved nitrogen in the body fluids because of the high pressure. And because nitrogen is not easily metabolized by the body, we don't use it for cellular processes that much. It remains dissolved in all of the body tissues until the oxygen pressure in the lungs is decreased back to some lower level, at which time the nitrogen can be removed by the reverse respiratory process. And this is called decompression sickness, when the decompression from low sea depth to high sea depth, like normal, no, sea level, no. There is the nitrogen cannot be processed properly by the body. Your body can develop decompression sickness, no? That the nitrogen is still dissolved, no? So the deep sea diving should gradually, the deep sea diver should gradually go up to the sea, at sea level, so that it will give the body a chance to return the nitrogen from dissolved to gaseous state in the body. So what happens if you have decompression sickness? You have dense, compressed, this is also called dense, compressed air sickness, Caisson disease, diver's Dysbarism. So this is a picture of a person suffering from decompression sickness. So you can see, this is a bubble. This is a bubble that the nitrogen in the tissues, no? That's why it's called a vent. It usually happens in the joints. That's a bubble. The black one, that's air. Okay. There shouldn't be air there. Okay. This happens when the diver suddenly comes back to the surface of the sea. And this is because of the nitrogen bubbles that form, no, in the body fluids, either intracellularly or extracellularly. So that's an example of a nitrogen bubble. Oops. It can cause minor or serious damage in almost any area of the body, depending on the number and size of the bubbles formed. So that's not good. Okay. So the nitrogen bubbles, no, can form in small vessels to large vessels. And when the bubbles block your large vessels, it can cause tissue ischemia or tissue death. Some also similar to your air embolism. Okay. What are the symptoms? Most common is joint and muscle pain in legs and arms. In the nervous system, you can have dizziness, paralysis, unconsciousness. In the lungs, you can experience the chokes or micro bubbles plugging the lung capillaries. You don't like bubbles in the blood vessels, no? this can manifest as shortness of breath, severe pulmonary edema, and possibly death. So what to do? So in decompression sickness, we try to eliminate the nitrogen from a gaseous state in the body. No? So if a diver is brought to the surface slowly, we're able to prevent decompression sickness. But if not, no, the nitrogen can usually be eliminated by expiration through the lungs to prevent decompression sickness. 2/3 of the total nitrogen is liberated in 1 hour and about 90% in 6 hours. So if you go down very, very, very low, the ascent to the sea surface should also be slow in order to give chance for the nitrogen to be liberated and not form gas bubbles. Okay, so in the last 30-40 minutes, we talked about aviation, space exploration, mountain, and even deep sea diving. And we've seen that the physiologic changes that happens with these different conditions. So with the knowledge of the basic physiology, hopefully you'll be able to understand the pathologic effects that these extreme conditions can cause to our body if not performed in a safe way. So good day. So thank you for patiently listening to my lecture. So have a nice day. Thank you.